Now, the Gauteng Health Department has denied claims of medication shortages in the provinces. This comes after several reports in recent years that the public health facilities in the province have failed to supply patients with adequate medication. For more on this, we are now joined by Nomantu, Nkomo-Ralehoko, who is the MEC for Health in Gauteng. MEC, a very good morning to you. Thank you so much for making time for us. So what's your characterization around the medication supply that is available through the various pharmaceuticals, including the reports that there is actually a shortage?
You know, Adrian, bayang'sukela ngifuna uyibeka ngesizulu manje. How I wish we had an opportunity, you and me, to go and see the medical depot that we have that is in Braamfontein. Just find time, because I don't like to come and dispute things that I know that they are correct here. Our medical supply depot is at 95% as we speak with the medication. And we are ready to make sure that all the people that need any medication, they get it. Because even that 5%, it's unlike it's not there. It's the medication. Maybe sometimes you need a Panado and then we don't have Panado, we have aspirin or Disprin. Then that's the only difference that we have. But 95%, you can go to our facilities. You can go even to our chemist, our own chemist, as the clinics. We even supply clinics that are mandated by the municipalities, the way that we have medication in our areas. And we have several proactive measures that we've done in terms of medicine supply, because there is not even an area that they can say we can't reach them, we can't supply medication to them. So our procurement team has increased even the stock that we have, because yesterday I was launching, if you have seen, launching the festive season, our state of readiness. All the teams were there, including the teams that are responsible for pharmacists. So what they are saying, it's not true. I don't understand where do they get that information, but I'm sure you have noticed several things that you always call me for them here. These are the things that we have, but it will be one individual that will just decide that and mislead the whole country. And it's not fair, really. I feel that people try to drag the Department of Health from where it used to be before. I always say, for the past 3 years now, we've improved the Department of Health. I have been there. I'm monitoring everything. There is no shortage of any medication. Tell those people they must just ask me, or you can accompany me now. An unannounced visit, you can just do it with me there, and we see the medication that we have in all the stocks, in all the areas that we have. For example, if I can tell you, at Bara, we have about 13 pharmacies that are inside Bara alone. In all those pharmacies, you find medication there. You go to Steve Biko, it's the same thing. I can take you there now, because I'm going to Pretoria. You will find medication, it's full there. There's nothing, no complaint there.
Yeah, because the thing is that if you look at, for instance, the report in the Citizen, they also speak about reports coming out of clinics that they don't have enough medication for patients. And that's the reason
why I'm saying it's not true.
Yeah.
That's why, Adrian, I'm saying it's not true. We have 33 community health centers that were mending in the province. Besides, we have all the municipalities that are mended by municipality, all the pharmacies that are mended by municipalities. Those pharmacies are supplied by me. It's us that are doing that. We're helping them even where they don't even have money. We don't say we don't have money. You can go to Thokoza. We just delivered Thokoza to 3 clinics there, medication, because they didn't even have bandages. And those were the municipal and clinics. But we didn't say it's not our clinics. We can't help them. We are helping everybody in the province. And nobody talks about that. The only thing that they want to do is to come and lie to yourselves and say we don't have medication. It's not true, this one. And I want to take it up, Adrian, because I'm tired of people that are accusing the Department of Health of things that we are not doing. Now I've just decided that I must take it up. Anyone that lies, I must make sure that I deal with that person.
Okay.
Because it comes out to the communities as a rule. Imagine everybody thinking that by December, who may not have medication by December, when you know that there are emergency cases that we are going to have.
Yeah, MEC, just quickly on the safety campaign for this season, do you believe that the province is well equipped to deal with incidents of accidents as well as fatalities that may occur during this period, as we know with the road accidents that happen during this particular period? Also considering, on the other hand, MEC, that you have some suppliers that are complaining that the department is not paying them on time.
we have 400 operational vehicles that are ready to serve the communities just on the EMS side. And we have trained over 3,700 community workers that are going to work across the province in assisting us. And we are going to open all the 11 offices across the 5 districts that will be able in terms of forensic now, so that if there are those cases that need pathologists, we will be having that. We will be having about 30 forensic officers that are ready for anyone that feels that they need to be assisted urgently to bury their loved ones. We have a total of 65 response vehicles, including those newly ones that we have just procured. Those ones just will not do anything except to wait for the festive season cases. We are going to open, we always open some mini hospitals in specific areas. For example, in Hillbrow, we'll have another one now at Bara in the APT. We'll have a ward that is just going to be dedicated for the people that are affected during this festive season, because we know our accident and emergency areas will be very busy. So we are ready for that, but we want to make sure that people must stop consuming too much alcohol. That's the message that we're saying, because most of the cases that we're going to have in December are the people that are drunk, that are fighting, that have been that stabbed each other. So those are the things that will make sure that we protect them. But we are ready. I can confidently say to you, we're ready. Even yesterday, we're showcasing all the cars that we have. We even have about motorbikes now that are going to run for emergency services whilst the ambulance is on its way to come there. We've activated our command center. It's fully equipped at Midrand with everyone, where we're able to see where the ambulance is going, that will be able to chase it and follow the calls in terms of those calls that will be receiving. Because if we're delaying, it will reflect red. We will personally be working, all of us. I've deployed all the chief directors, DTGs, directors, and HOD and myself will be assigned specific hospitals in every region that we will be monitoring ourselves. Besides that, there will be those teams that are on the ground. When it comes to suppliers, we are paying suppliers, Aldrin, including that question last week that you wanted to ask me. If you can hear what was the problem, you will really be surprised, because we're paying those people. We paid even them last week in the system, and we've been paying them every month as per our agreement that we have with them. So we don't understand what they were trying to do. But even that one, we're not letting it let it go. I am in consulting the legal team, because we want the CEO and the CFO of that company, including our teams in the department, because they had a meeting already of trying to clarify where was that come from. And unfortunately, they are distancing themselves from that message that says we're not paying, because we're paying them. It's not true, again, what that person was doing. Where we have big accounts, Adrian, for the past 3 years that I've been in the department, we sit down with a person that we owe you more than 20 years, because there were suppliers that we owed a lot of money for years there, but we had to sit down and do a breakdown. Yeah. Who are we owing? How much are we owing you? We verify those accounts, and we can't just pay you if we're not verified. And that process now, it's running very smooth, because people acknowledge where we're owing them, where they're overcharging us, they acknowledge that, but we are ready even in terms of payments. Small suppliers, I always say SMMEs must be paid. That's why our runs now are not waiting for 1 month. We always run almost every week so that we're able to pay people. But if we have a problem with a supplier, we tell a person that this is the amount we can pay you now. And they all agree, and they're happy about it.
Yeah, but that's not what the Public Service Commission is saying in terms of when it comes to payments on time. But I just quickly want to move on from that point, MEC.
Let me not leave that one. Let's clarify that one, because we had a meeting with the commissioner. The questions that he was asking you, it's exactly these questions that I'm clarifying you. Babma Vuso, who's the commissioner, we have meetings with him. We even check our books. He knows exactly who we are paying, who is in the system, who have not been paid. The person that ran to the Public Service Commissioner is that very same person that I said to you. We had a meeting with him last week.
Okay, let's quickly go on to this point. So Joburg Water has announced that there will be water disruptions for 86 hours over the weekend. There have been concerns that have been raised that this could also lead to some health problems, considering that you have gatherings that will be taking place during the festive season. Is this a concern at all for the MEC from a health perspective, that you would have 60% of the residents in Joburg not have access to water? If they do have access to water, it will be driplets.
It's a serious concern indeed, but what we have done, we are going, as we have said to you, we have that backup team that is going to work in the hospitals. We said to them, all of them, they must give us a report which hospital that will experience a problem. In some of the hospitals, we have boreholes. Where we don't have boreholes, we must fill up our tanks. But again, we are going to have bottled water that is ready, that is just readily available, especially for the patients. But in critical areas, we'll definitely need to fill up those tanks where we are going to have a shortage of water. So we are ready even for that one. Because remember, 3 months back, we were hit by that in areas like Yokalafong, you remember, in Atteridgeville. Then we knew now what we must do when we have a problem of water.
Thank you so much for your time. That is the MEC for Health in Gauteng, speaking to us about some of the concerns that have been raised in terms of medication shortages. She's clear that there is no shortage